There's really four major agents in pivotal phase 3 trials. We've discussed Magrolimab. Another one is Sabatolimab, which is completed accrual in their phase 3 trial, which has an OS powered study. It's unique in that Sabatolimab targets TIM3 and that it targets both the leukemic stem cell as well as blocking a negative immune checkpoint on T cells, sort of a dual-pronged approach. I think the key, and to be the most important abstract actually presented at this meeting in MDS is being presented by Dr. Zidane, which was the randomized phase 2 trial. I think the negative of this study is that response rates were not improved. I don't think that's necessarily that surprising based on the earlier phase 1 data, but the goal was to see an improvement of event-free survival, and unfortunately that was not, in the total population, was not beneficial, although in the subset of patients with intermediate risk disease, there did appear to be some separation, and I think there's interest in looking at that group by itself. I think that being said, it's a smaller randomized phase 2 trial, and we're still optimistic about looking at the phase 3 trial, but I do think was a setback from those results to date. The VERONA trial is the phase 3 Venetoclax trial. I think there's been a lot of real-world data showing relatively similar outcomes to phase 1. Again, a majority of patients responding, although true complete remissions around this 30% realm. I think we're also eagerly awaiting both the CR and OS readouts of that phase 3 trial. And the last pivotal one I would mention is Tamibarotene, which is a RARα agonist in the SELECT-1 MDS trial. So it's only being targeted in patients that have RARα overexpression, which is around 50% of MDS patients. It's actually the only ongoing, actively accruing study. So I think it's worthwhile from that perspective. And then I think a lot in the future is thinking about different triplet combinations. I'd be very interested in looking at AZA-Ven-Magro and AZA-Magro-Sabatolimab in MDS, and I hope those trials can occur in the future.